Thank you, Mr. President. I want to address an amendment that I have for the Obamacare repeal bill that we will be voting on relatively soon. It's a simple amendment. I think it's an important one. And it addresses part of the $1.2 trillion in tax increases that are embedded throughout Obamacare. This, in particular, is a tax increase on middle-class Americans who are battling with catastrophic health care challenges and costs. And so I think it was a particularly ill-conceived tax increase, and I want us to repeal it. Here's what the tax increase was about, Mr. President. Prior to Obamacare, if a family had out-of-pocket medical expenses that exceeded 7.5% of their income, then they could deduct from their taxable income, they could deduct any cost above 7.5% of their income. Obamacare raised that threshold to 10%. And that has very real consequences. There was an exception for senior citizens, but that exception expires in 2016. And this tax increase on middle-class Americans makes it harder for families who are trying to deal with, to battle some kind of really problematic health situation that they're in. It could be a chronic disease, it could be a catastrophic event. And let me be specific about an example. Prior to Obamacare, a family that earned $50,000, for instance, if they had extraordinary medical costs for whatever reason that were, say, $4,500, so 9% of their income, that's a huge medical bill for a family that earns $50,000, obviously. Well, at least prior to Obamacare, they could deduct $750 of it. That portion which exceeded 7.5% of their income was deductible. Under Obamacare, they can't deduct any of it. They get no deduction. So think about what we're doing. We're saying that middle class, working class family with unusually, extraordinarily high medical bills should lose the opportunity that they've historically had to at least get a modest deduction to help soften the blow of the catastrophic health crisis that they're dealing with. I think this is a terrible idea to hit these folks with this tax increase, especially at a time when they're dealing with these very difficult circumstances, or they wouldn't get the deduction anyway. So, Mr. President, I think it was a bad idea, one of many bad ideas in Obamacare. And what my amendment would do is simply restore it to where it was before Obamacare. Restore the ability to deduct that extraordinary health care cost when it exceeds 7.5% of income, rather than having to hit the 10% hurdle that Obamacare created. By the way, I should point out, this is totally a tax increase on middle-class families. The IRS quantified this. They determined that 86% of the taxpayers who claim this deduction, 86%, earn less than $100,000. This isn't a tax deduction for rich people. This is a tax deduction for ordinary Americans who are going through very, very difficult times. Having the ability to take this deduction is more important now than it's ever been, because Obamacare has done so much to drive up people's costs, right? That's not just my saying this, right? November 15th, New York Times headline, quote, "Many say high deductibles make their health law insurance all but useless." That's the New York Times. Well, high deductibles are one of the main contributing factors to people having a high out-of-pocket cost. So Obamacare has driven these plans into these high deductibles, thereby forcing people to lay out more cash. And at the same time, we're saying, oh, but you can't deduct it like you used to be able to. November 2nd on CNBC, they reported that Obamacare's cheapest plans just got more expensive. There are deductibles that are soaring to over $12,000, out-of-pocket maximums that are near $14,000. People are incurring out-of-pocket expenses like never before. And they're getting hit with the fact that they can no longer take the kind of deduction that they used to. Mr. President, this is a bad idea in the first place. It is a tax increase on those who can least afford it, people who are sick, people who are undergoing maybe a terrible accident, some other disaster that caused them to incur these expenses. It could apply to someone who's got long-term care expenses for a relative that's in a nursing home. It could be the special education expenses for a handicapped child. It could be a mom undergoing reconstructive surgery after a mastectomy. It could be a couple that's seeking to conceive a child and needs fertility treatment. Any number of circumstances that I don't think we should be punishing people in this fashion. So what my amendment would simply do, as I said, is it would restore the tax deduction to the threshold that we had before Obamacare, and I would urge its adoption. But, Mr. President, as I mentioned, I think this medical expense deduction issue is really just one, and it's important, but it's a narrow aspect of a unbelievably flawed bill. It's hard to know where to begin with the flaws of Obamacare. I would suggest several big categories of problems. The first is higher costs. The second, I would suggest, is the loss of employment. And the third, which is indisputable, is the loss of freedom. So higher costs, I think, are undeniable. The president promised us that average premiums would fall by $2,500. In fact, he was confident enough to give us a figure. And of course, the exact opposite is what has actually occurred. Obamacare premiums have gone up dramatically. In my state of Pennsylvania, premiums are up for next year alone 11%. That's after several years of increases prior to an 11% increase. Who do you know that's got an 11% pay raise? I don't know anybody. That's not what's happening. But yet their expenses are going up because of Obamacare. Deductibles are rising at the same time. So not only does it cost more to buy the insurance, but the insurance covers less. I've gotten letters from literally thousands of Pennsylvanians explaining their personal circumstances. One letter came from the DeBello family of Montgomery County. Before Obamacare, they paid $662 a month for a health insurance plan for their family, and they had a $6,000 deductible. They were happy with their plan. They were promised that if they were happy with their plan, they could keep their plan. We all heard that promise. How many times was that promise made? That promise was made to the DeBello family. The only slightly unfortunate problem here is everybody knew it was untrue, including the people making the promise, because the legislation explicitly forbids whole categories of plans. How could you keep your plan if it's being banned by the federal law? Well, the DeBello family unfortunately experienced that. And so in 2016, the plan that they are buying that goes into effect in 2016, instead of a $662 monthly premium, they're going to have to pay $1,141. And instead of a $6,000 deductible, they're going to have a $12,800 deductible. You almost have to wonder, what is my insurance paying for if the deductible is that high? But that's what Obamacare has done to the DeBello family of Montgomery County, Pennsylvania. And let me assure you, Mr. President, that they are but one of thousands and thousands of families that I've heard from across Pennsylvania who are experiencing similar real difficulties. I mentioned jobs as another category of problem that Obamacare has created. Again, I think it's completely irrefutable. We know that if you as an employer hire a 50th employee, you are suddenly subject to all of the mandates of Obamacare. That means your health insurance for your workforce, the costs go through the roof. It creates a huge incentive not to hire the 50th employee. That's a terrible incentive to have, especially at a time when we have too few people working and we have inadequate wages, and yet this provision guarantees that it will be more difficult to get a job with a company that has 40 some odd employees. In addition to that, Obamacare puts pressure on employers to cut back on hours for workers because you're deemed to be a full-time worker if you work for 30 hours or more. Well, one way to deal with that is to have people work fewer than 30 hours. The problem is the employees, they want 40 hours. They want a normal work week. but they can't get it because of the costs that Obamacare triggers if they were to have it. Thirdly is the loss of freedom. That is, again, completely irrefutable. If you had a plan that you were happy with, you had a plan that worked for you and your family, it was the right mix of benefits, premiums, and deductibles for you, and you wanted to keep that plan, well, good luck. You can only keep it if the government approves of it. So now, we don't have the freedom to have the health insurance plan we want. We're forced to buy the health insurance plan that the government dictates you shall have, whether you like it or not. What an egregious affront to the personal freedom of Americans to decide what's right for themselves and for their families. Last thing I want to point out, Mr. President, is a very fundamental structural flaw in the model of Obamacare. Yet another reason why this needs to be repealed. And that is, this bill was designed with the idea that young and healthy people would go out and buy health insurance through Obamacare at an inflated price. Because, of course, in addition to dictating what is in a health care plan, Obamacare dictates pricing as well. And the theory was, what we'll do is we'll have all these expensive mandates, but we'll force this category of people, they tend to be younger and healthier, we'll force them to pay more than it costs to actually insure them, and that is how we'll subsidize coverage for people who are older and need more health care. There's only one small problem with that, and that is that the younger and healthier people figured it out pretty quickly, that they're being forced to buy a product that doesn't suit their needs very well, and they're forced to pay more than it's worth. So guess what? They're not doing it. And Obamacare is falling short by millions, falling short of the number of these younger, healthier people that their model depended on. What's the result of that? Well, insurance companies are left insuring a population that tends to therefore be older and sicker. That costs more. So when the insurance companies lose many millions of dollars, which is what they've been doing, they go back and say, well, we got to raise premiums even further. Well, that creates even a more powerful incentive for younger and healthier people not to buy the product. It's now, what started off as overpriced, is now even more overpriced for them. This, Mr. President, is known in insurance terms as a death spiral. This downward spiral whereby it becomes impossible to have a viable continuation of these insurance policies, because increasingly the only people who will buy them are the people who are very sick, and people who are relatively healthy are priced out of the market. This explains why half of all of the insurance co-ops in America have already folded. Many seem to be heading in the same direction. A year from now, I doubt there will be many co-ops remaining. And this also explains why increasingly insurance companies are simply saying, we're going to have to consider getting out of this market altogether. We're going to have to consider simply not participating in Obamacare. What does that mean for Pennsylvania families? It means they're going to be out of choices. If there are no insurance plans being offered through this exchange because the whole dynamic doesn't work, then how are my constituents going to get health insurance? This is the problem when the government steps in and tries to take control over an industry, in this case, something so important and so personal as our health care, Mr. President. So this is a fatally flawed piece of legislation. Its disastrous consequences Americans have been living through in the form of losing the health care plans that they want, that they valued, that they chose, experiencing much higher premiums, higher out-of-pocket costs, higher taxes on the costs that they do incur, and fewer jobs and fewer hours for those who are employed. Now, in addition to all this, we see what I think is the relatively early stages of this death spiral that is going to result in probably a pretty massive exodus from this market. So, Mr. President, long overdue that we repeal this legislation. I am very glad that we will be able to consider this over the next day or so. I would urge support for my amendment, which would restore the ability of people facing catastrophic costs to have the deduction that they were able to have before Obamacare, and I would urge adoption of this repeal legislation. I yield the floor.